We know fruits and vegetables are an important part of a healthy diet, but they are expensive. With the rising cost of food and inflation, many people in this country simply don't eat enough of them. Some American doctors are now using a new strategy to get patients to eat well, a so-called produce prescription, and the benefits appear to be significant. CTV medical expert Dr. Marla Shapiro joins us now with more. I am so intrigued by this study.
It's a great study. It's called the Food is Medicine Study. It was an American study where actually doctors wrote a prescription, and they also subsidized patients in this study. And in the study, they really wanted to see over a short period of time. So this is about a 10-month initiative, followed up 6 months later. So that's a pretty short timeline to see what the benefits would be, because yes, it's really a concern about getting the appropriate fruits and vegetables. If we look at what poor nutrition can lead to in terms of diseases overall, it's a major driver of chronic diseases globally, estimated in the United States that accounts for about 8 million deaths. Think about those numbers.
Wow.
And cardiometabolic conditions. So what does that mean? Type 2 diabetes, heart failure, all types of cardiac diseases like heart attack or stroke. And when you think about it, food is one of the most important elements in terms of prevention, yet sometimes it's very difficult to talk about it as a prescription.
I think even when you think about yourself and your own mood, if you're not eating properly or if you eat too much sugar in a day, you can really feel that impact just in one day. So long term, it's certainly going to have a big impact.
And it was a large study. So if you look at who was in the study, it wasn't only adults, it was children as well.
Okay.
So they reported on about 1,800 children and over 2,000 adults. All these participants had food insecurity, but they were either at risk for heart disease or type 2 diabetes, or had heart disease or type 2 diabetes. The adults were about 54 years of age or so, good representation across different ethnic groups, men and women. Average age of the child in the study was about 9 years old, 50-50 split between boys and girls. And when you followed them over time and looked at what happened, well, not surprisingly, what we ended up seeing was, firstly, people started increasing their food intake. They were given the funds to do this, so it made it easier for them. But in terms of the actual increase, in the next board that we have, it lays it out for you. The adults, just slightly less than a cup a day in terms of increasing their fruits and vegetables. Kids, about a quarter cup a day, increasing their fruits and vegetables. And then it was remarkable because in the adults and the kids, we saw a systolic blood pressure. That's the upper number. When I say your blood pressure is like 120 over 80 or 130 over 75, that's the upper number, the systolic pressure. That's when your heart is beating. Dropped by 8 millimeters. We consider that quite significant. In people who had high blood pressure, the lower number, the so-called diastolic or resting phase of your heart, dropped by about 5 millimeters of mercury. Blood sugar dropped substantively. The BMI significantly dropped in adults. In a short period of time, we're talking like 10 months or so, adults were 62% more likely to say that they felt better, and even kids said that they felt better, about 2 times more likely to say they felt better. And if you look at these outcomes in such a short term, they're almost equivalent to some of the medications that I might offer you to drop your blood pressure or to drop your blood sugar. So it's really an astounding study.
So produce as a prescription, like that they're helping people, they're subsidizing
in this study they were.
This healthy food. And so it's almost that pay now versus pay later approach. We're helping people be healthy now, and that's going to carry years down the road.
Years of benefit. So, often I'll say to my patients, where you do your grocery shopping, think of that as your pharmacy, because the choices that you make in terms of fruits and vegetables is really critical. We know the expense is great. That's why this particular study in the States looked at subsidizing. But the messaging is really clear. It was a 10-month intervention with a 6-month follow-up, and the benefits only will get better as you continue to follow people over time.
Look at your food as medicine. I really like that.
Absolutely.
Thank you so much for sharing this with us today. Dr. Marla Shapiro is CTV's medical expert.